Welcome to Rajendra Tandon videos. I'm taking up two very important sicknesses today for discussion. The first one is Addison's disease and the second is anemia. Addison's disease is a rare problem in which the body becomes incapable of responding to physical stress. Its symptoms are dark spots inside the mouth, loss of appetite, nausea, pain in the abdomen, low blood pressure. The skin turns dark more so on exposure to the sun. The patient experiences complete exhaustion after even a slight effort. Slight injury or infection leads to collapse. Now, most of these are serious situations, and I would recommend that when such a situation occurs, consult a physician. However, the homeopathic medicines which I suggest are of great advantage according to symptoms. The first one is arsenic alb 200, ARSENIC-ALB 200. There is ulceration of the mouth. The tongue turns blue. Now this is something which is rare. So if it turns blue, watch out. You can't miss that sort of color. The skin is darkening. There is debility, exhaustion, restlessness with nightly aggravation. The patient detests the sight of food. However, he is thirsty and the thirst is unquenchable. In spite of being greatly thirsty, he takes little water at a time. There is nausea, vomiting after a meal. Inside of the stomach, there is burning. Arsenic alb takes care of these symptoms. The second medicine for Addison's disease is phosphorus 200, PHOS, PHOROUS. Small wounds bleed a lot. Now this is a symptom which you can't miss. Small wounds bleed a lot. They heal and break. They heal and break. The spirits are low. The brain is tired. There is vertigo on standing. The patient faints. He stands, he faints, falls down. Cutting pain in the abdomen. Relieved by cold food, cold milk, cold pudding, cold cake. The patient is worse on physical or mental exertion in the evening with warm food or drink. All these symptoms require phosphorus 200. I take up anemia, which is very common, particularly in menstruating women and even in others. It's a common blood disease where the number of red blood cells in the body is reduced considerably. Further, within the red blood cells, there is a dilution in the red hemoglobin, the pigment that carries oxygen. In severe anemia, a patient's life is at risk. Please consult a doctor. Go to a hospital. The symptoms of anemia are well known. There is pallor of the skin, ankles are swollen, the patient is easily tired, feels dizzy, suffers from headache, shortness of breath, palpitation, and lack of sleep. Look at the patient's diet. Quite a few cases can be redressed by changes in a diet. Talk to a dietitian. Persistent anemia is not desirable. Take medical consultation at the earliest. Life is in danger. In cases of profound anemia, when the face and skin are waxen, swollen, and cold, lips are blue, acetic acid 30 comes in. ACETIC acid 30. Mind the symptoms: face and skin waxen, swollen, lips blue. There's cold sweat on the forehead. The eyes are sunken, dark rings around the eyes. In women, when there has been an unusual loss of blood after labor, a diabetes patient, great thirst, copious urine, debility, all these are helped by acetic acid 30. The next medicine for anemia is arsenic Alb 200 for total prostration and anxiety. Cerebral anemia due to malaria or excessive use of quinine. There is violent palpitation, swelling, stomach is easily upset. Anemia in children responds to Calcarea phos 30, Calcarea phos, PHOS. The child is peevish, he is flabby, his digestion is poor, he experiences numbness, a crawling sensation. Calcarea phos is also useful in women with excessive menstruation and violent headache. Anemia caused by excessive outflow of liquids from the body for whatever reason requires China 200, a sure remedy. CHINA 200, excessive flow of liquids from any part of the body. Abnormal loss of blood in injury, tooth extraction, gastric ulcers, piles, menstruation. The mind is weak, the patient is unable to think, to concentrate, loss of memory, splitting headache, dizzy when walking, noises in the ears, face is pale, eyes are sunken, sweats easily on motion. All these require China 200. It's a great remedy. In cases where the patient is thin, pale, weak, easily exhausted, there is a shortness of breath, he is worse sitting and lying in bed, we give ferrum aceticum 1000 once a day for a few days. Ferrum FERRUM aceticum ACETICUM 1000. It tackles even stillborn anemia. If anemia occurs after intermittent fevers like malaria, typhoid, the face is pale, at times face is flushed, skin puffed, pits on pressure, extremities are swollen, cerebral anemia, the patient faints easily. Give ferrum met, FERRUM MET 200. Another anemia medicine is ferrum phos 200 with throbbing pain in the head. The scalp is sensitive. Now these three medicines are made from iron, and iron is an essence of the blood. In cases of chronic anemia with depression, where the patient wants to be left alone to cry, he wants to weep, give Natrum Mur 200, our common salt, a product of earth and water. It is caused by loss of fluids, by irregular menstruation, by grief or any other sickness of the mind. Symptom is chronic anemia, depression. There is numbness and tingling in fingers, in lower extremities. The legs are cold, ankles weak, they turn easily. The patient catches cold easily. His body is weak, emaciated. The palms are hot and sweating. The symptoms are very clear. Natrum Mur 200 is one of the finest medicines for anemia. if these symptoms are present. In pernicious anemia, which just doesn't go, use picric acid 30, PIC, RIC, ACID, acid 30. The bone marrow lacks vitamin B12. Tongue is inflamed and sore. The fingers are numb. There is persistent diarrhea. Again, symptoms are very clear. There are cases where the nails are dry and brittle. This anemia follows pregnancy, copious menstruation, and any other blood loss. We give Silicea 200, SILICEA 200. Now a word of advice. Improve the diet of the patient. If the diet is good, anemia would not normally occur. For confirming the diagnosis of anemia, get a blood test done. This would show and guide you as what to do. After all this, look at the symptoms, match them with what I have described, and use the particular medicine. All these medicines are properly differentiated. Sometimes there can be an overlapping, but the symptoms are so clear cut that generally one does not commit a mistake. I wish you health and happiness. I thank you for visiting this site. There is more to come. You are welcome. Bye. Bye for the time being.